Welcome back to another edition of TCM Graduate TV. I'm Kenton Sepsic, registered acupuncturist. This is episode 123, and today we're talking about the next heavy hitter on the gallbladder channel, GB29. Now, it's very important when our patients tell us that they have hip pain for us to ask them to show with their hands where the hip pain is. Oftentimes, they'll tell us that it's around the SI joint. At which point I'm going to go down a different direction. That being said, if they do tell us that it is in fact right over top of the hip joint, then GB29 is a very good adjacent, not local, adjacent acupuncture point to help me treat that condition in the clinic. When I was in my first year of acupuncture, I was so not confident in treating hip pain. True hip pain, true hip joint pain. If this is the hip, again, I don't make a very good artist, I make a great acupuncturist. If this is the hip joint and the patient's leg is going out this way towards their foot, I would have a heck of a time treating this in the clinic. I would not get the results that I could get treating anxiety, depression, dysmenorrhea. This condition would drive me crazy. So at some point in my early career, first couple of years, I thought I'm going to go right back to basics. Wherever there's a pain, there's a point. So of course I would use GB29 and it would get me some results. But I started asking the patient, where do you have pain? And they say, well, I have pain here in this joint, and it's such a wide area. So I would do kind of one of two things. Now, my first treatment for hip joint pain, it's not all that fancy. It's just basically like a grid treatment. So I push and I say, do you have pain here? And if they have pain, they will be very sensitive in the area. Yes, ow, that hurts a lot. That's a what? An asha point. Ah equals O. And sh means yes. Does it hurt here? Oh, yes, it does. So then I'd put a needle there. So then I'm going to look almost like 1 to 2 inches away in a grid-like fashion. Do you have pain here? Yes, it hurts there. Do you have pain here? No, not so much. Okay, I'm going to go back to the original one. Do you have pain on the other side? Yes, it hurts here. Do you have pain up here? Yes, it hurts here. Do you have pain here? Yes, 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 no, yes. So I'm going to create like a grid-like treatment and find all the asha points. Now, of course, I'm going to use my amazing adjacent heavy-hitting acupuncture point, GB29, to help me with this. So I'm going to track this out between the ASIS and this center of this hip joint here. Let's say it's here, and we're going to get that GB29. And it's going to help me with that condition. So just want to give you that information. This asha grid treatment that I likely haven't come up with, it just came up with because I was in my own space, in my own clinic, and I needed to go back to basics and figure this out myself. I just want to share that with you because it might be beneficial when you treat hip pain in the clinic. Now, I said I do two things, so I should share that. So the first thing is I like to start with the grid treatment. And I also like to do cupping over needle. And this can be quite effective as well because, as we know, the cup is going to pull up the muscle, the skin, the fascia all around the needle. So let's say this is the central point where all the pain kind of stems off of. That's where I'm going to put a large cup over top of that needle, and that helps me augment the treatment. That being said, I like to start with the grid, then maybe a couple treatments in, I might switch to the cup over the needle, maybe go back to the grid, at which point, 2 to 3 treatments in, the patient's already starting to feel a lot better. So there you have it. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for watching this video.